So delighted to meet you in the program of Tea Kadai Bench.
Hi everyone. Good morning, sir. So one patient presented with a alleged history of consumption of 10 metformin tablets. So what would be the consequence, sir? So generally metformin won't produce hypoglycemia. So in the patient la neenga enna sir nenikiringa?
Yeah, I agree with your statement. Since metformin doesn't act on the pancreas, since it doesn't extract insulin from the pancreas, so hypoglycemic incidence is very, very rare, of course. But metformin acts on the liver. It reduces hepatic glucose output. In fact, it acts at the periphery of the peripheral cells, especially on the muscles. It increases the insulin sensitivity. So generally, pharmacological doses, I could say up to 2500 milligram. If it is given as monotherapy, it won't produce hypoglycemia. But suprapharmacological doses, something like this, 10 gram, then we have to wait for that. So we have to anticipate some form of hypoglycemia. Anyway, patient has been admitted, so we are keenly monitoring glucose level.
Okay, sir. How metformin acts, sir?
As I told you earlier, it acts at the liver. It tries to reduce hepatic glucose output. Mainly, it acts at muscles. It increases the sensitivity of insulin receptor in the periphery, by which glucose entry into the cell is enhanced.
So what are all the contraindications for metformin, sir?
So any patient, if you want to introduce metformin, please look for eGFR. Generally, if GFR is less than 30 ml, you try to avoid metformin. And most of the organ failure, if somebody presents with cardiac failure or chronic liver disease, cirrhosis, or CKD, generally you try to avoid metformin.
So why it is contraindicated in organ failure, sir?
So most of the time what happens, most of the organ failure, they exhibit hypoxia. You will agree. So hypoxia produces lactic acid, because in the presence of hypoxia, glucose won't be converted into ATP molecules in TCA cycle. Glucose will be converted into pyruvate. Then pyruvate will be converted into lactate in the absence of oxygen. So most of the organ failure, they have some amount of lactic acid. So theoretically, metformin also produces lactic acid. So if you put metformin in organ failure, so naturally your lactic acidosis will be worsened. That's the reason in all organ failure, we are very cautious in introducing metformin. Not only organ failure, sometimes we stop metformin transiently during the time of surgery and during the time of contrast administration. Suppose when somebody undergoes IV contrast for CT scan or MRI, we withhold metformin transiently, and during the time of alcohol intoxication also. So generally what happens, alcohol inhibits lactate dehydrogenase. So lactate dehydrogenase is responsible for the pyruvate to lactate and lactate to pyruvate. It's a reversible pathway, we used to say. So since alcohol inhibits lactate dehydrogenase, so lactate won't be converted into pyruvate again. So again, theoretically, there is a chance of worsening of lactic acidosis in alcoholic individual generally. Otherwise, metformin is a wonderful drug. It is generally indicated in obese individual, obese type 2 diabetes. Recently, even the lean diabetes also, metformin is strongly advocated. And not only that, metformin offers many benefits. Even though it is considered as weight neutral, in some patients, it has the potential to produce weight loss as well. It reduces the triglyceride formation in the liver. So it has very favorable lipid profile. And I could say it offers cardiovascular benefit. So for all the practical purposes, the metformin should be the first choice of anti-diabetic drugs unless it is strongly contraindicated. So this is I could say this is a whole sum of metformin basically.
Okay, sir. Thank you, sir. Thank you for all your valuable explanations. Thank you, sir.
Thank you.